should they be scared that AI is going to be indirectly responsible for their job scarcity? Yes. How? Because they will be replaced by people who know AI. They'll not be replaced by AI itself. They will be replaced by people who know how to utilize AI to the max. Today, I can do something and somebody else can also do this. If I can do it in less time, I will replace that person. If that person is able to do that same task, because time is money in this time and day and age. If you are able to utilize AI to reduce human effort, AI is not just reducing the time taken, it is also eliminating the human error.
Hello folks, welcome to another exciting episode of Healthtech Innovation 2024-25. I'm your host Arvind Sareen, CEO and Chairman of Copper Digital. Today, we have the privilege of hosting a fantastic guest whose impact on the healthcare sector extends far beyond traditional boundaries. She was a practicing dentist who turned to a product and growth leader at Teledentistry.com, a health tech startup that provides online dental consultations and services. With an MBA from Liverpool University and 6+ years of experience in healthcare, she specializes in driving innovation and delivering exceptional products that meet customer needs and market demands. A very warm welcome. Welcome, Dr. Mamta Kodwani. Welcome to the podcast.
Thank you. Thank you so much for having me. I cannot wait to start this. It's
wonderful.
Amazing.
We were also super excited because you're one of our guests who has a very unique background, who was a practicing dentist and now you're a product owner, a product and growth leader, which is fantastic. So would you mind, let's get started with that as something that audience can try to understand. So why did you make this shift from a practicing dentist to a product and a growth leader at Teledentistry.com? And you can also tell us about, what Teledentistry.com does.
Okay, great. So how did I did this shift from a clinician that was just in a cabin doing regular patient treatment, from there to here, where all my days spent over here is about tech. It is about patients, and it is about the aspect that I was not aware of when I was in clinic. The only thing that we knew was drill at all, you put the filling. Right now, it's everything but not that. So the shift in itself, I guess, if I look at the positive side of it, the shift was because I wanted to create a bigger impact. In a clinical setup, the number of patients or the number of people that you can impact directly is confined to a certain number. You cannot do more than that. That's not humanly possible. But with tech, you can impact a larger number of audience. So I went from 20 patients a day. That was the max that I could do in a single time frame. From there, I went to right now with Teledentistry. We are covering almost 100 million lives. So I am directly, indirectly responsible for these people emergency needs. So that is huge. You cannot get that kind of number change from anything else. You cannot be able to impact even 100 lives from a clinical setup in a day. So that was one, the positive impact. The second is one of the reasons that I would really want to share is a lot of people don't take into considerations that there might be something in the doctor or the practicing person's life that is withholding them from practicing. One for me was my physical injury. I had an injury because of which, just imagine a dental surgeon has a physical problem. Now, how are they going to operate? How are they going to work on a patient? And that time frame where I was not with patients, not doing anything, I was not able to practice, I realized that okay, if something happens to my hand and I cannot do anything else from here. It's just end of what knowledge I carry. It is end of all the practice that I've done, or the fees that I've paid, everything, so that everything gone in front of you. And I was not sure how long will the recovery period take. So that was where I was like, okay, maybe I can find different ways of one, helping people, because I knew that I wanted to help people. That was one, how I can help people. And second was like how I can stay relevant in the world. So that is how this kind of shift happened. from there, I enjoyed this side of the world where tech is being discussed, where AI and everything is just changing. In dentistry, you can do the same root canal 25 years and it'll still be relevant. But over here, if you're talking about a certain feature and if you're too late to launch it, you're done. So from a very slow background to coming a very fast paced world, that was amazing. Now coming
For our audience, if you can explain what really teledentistry does, although the name pretty much is self-explanatory, but if you want to explain a little bit more, like what does your company do?
Definitely. So teledentistry is a virtual dental care. It's a virtual emergency care. So the dental pain that we experience or our patients experience, it doesn't see normal office hours. It is going to come at any time, and it will not care whether you're traveling or whether you're with someone or you're any of that. So you need sometimes an emergency care within minutes that is accessible to you. So that is what at teledentistry we do. We give 24/7 availability. We give emergency dental care right in, if you have your phone, if you have a connection, that's it. You don't need anything else. We are there to help you. And within few minutes, we are able to verify your insurance, do everything that is required, and just get you to connect with the dentist. All of this within 5 minutes, and within 10 minutes, you have a solution for your problem. And that is what we need with dental pain. Notorious and really bad for people who have experienced the dental pain. They know that how important it is to get an emergency help over there.
So how does it work? Like, I understand, I've had a lot of telemedicine myself, meaning if I don't want to drive 30 miles to my PCP in Rowlett, then I would just set up a virtual consultation with him where he would ask me some questions and then give me any prescription, or if needed, then he'll call me to the next appointment and do it in person. But how does it work in dentistry? Because isn't it all about looking inside your mouth and then drilling hole like you said, or doing something to relieve the pain? How does a virtual consultation help in dentistry?
Correct. So in a virtual consult, whenever if you have done a dental checkup or anything, they don't give you or they don't start treating you mostly in the first sitting itself. They will prescribe you some medication. And even in a dental pain, if the pain is unmanageable, you cannot really operate. You have to give them medication to bring it down so that the patient can be operated. So that is what we do. The main focus over here is not that whether we'll be able to deal like this. Definitely not. We'll not be able to do. But can we take care of the step one of the patient? So we're giving them medication. We're telling that there are a lot of times where only medication or only a sort of patient education is enough for treating the patient. Those are the cases where we come in. But in major cases, what we do is we are basically avoiding their emergency room visits, so that we are giving them the medication, and later after the medication has subsided their pain, they have enough time to go back to the clinic and get whatever help is needed. So we are basically addressing or helping people, one, who cannot reach to a clinic, or two, who are basically going into clinic just to get their medication. So
Makes sense. No, and I love it. I think that's using the resources definitely more efficiently. And of course, like you said, people who are in remote areas and suddenly something comes up, then they at least want to get the diagnostics done properly, and that can be done. Do you also have any basic tools, like if you wanted to really look inside someone's mouth as a dentist? And this is just me being curious, and tell me if that's not available, but or do you see this in future, like there may be a Bluetooth enabled camera that someone could put in their mouth and has some sort of lights as well, and the dentist could really do a good job of diagnosing, okay, well, this is a cavity, or this is, some deposits.
Correct. So in future, yes. Currently, I mean, though there are devices like these that exist, it's just that it's not readily available. And of course, you and me, people like us who would have really an issue, we would not keep that particular thing with us. But there are patients that require this for continuous monitoring. So continuous monitoring is a very good thing that is coming in dentistry and healthcare. Very recently, it was not there previously. You just had to go back to your doctor and used to give your each and every vital to them. But now what is happening is you can just digitally, they can monitor you. You're saving a lot of time, you're saving a lot of money in that sense. So if a patient is going for a longer treatment, so maybe if a person is going for an ortho treatment or if they're going for a perio treatment, they can be these kind of devices are very cheap to get. You can get that and then constantly be in touch with your dentist, and they can monitor if the whole treatment is going, the post-op care is taken care of. So that is something that I can see happening in future as we're talking about 2024 and 25. I can see that a lot of these technologies are coming into picture, but right now very few of them patients have it, but very few of them have. How we do right now is, as we are doing right now, we can ask a patient to show, we'll be able to guide them to give us a proper location, and we can see it over there. Most of these problems, they arise, and the pain starts when it is visible. There are some cases where the problem is not visible, but we as a trained dentist are very much well aware of what is happening. Of course, when you come to a proper diagnosis, you can only give diagnosis when you have supporting x-rays and stuff like that. We have a lot of those things as well. But for now, when you're giving that particular patient a medication, that is very much possible with telemedicine.
Got it. Okay, wonderful. So what is the market that you serve at teledentistry.com? Is it all over the globe, just the US, or?
Very focused in US market. That is what we are doing currently, because over here itself, there are so many patients that don't have that access. They don't they're not privileged enough to stay in a locality where they are easily accessible to a dentist. If we think about patients who are at high risk, someone who has immunosuppressant, someone on immunosuppressants, patients who are having some or the other issue because of which they cannot walk to clinic. So that population in itself is such huge that if we can you can take a smaller audience and deliver 100% result, that is still better than being available everywhere but not being able to help them. So we are in US market.
But super interesting, and thank you for sharing some of those insights. How your organization is revolutionizing the healthcare industry using technology or AI.
Okay. So we'll start by discussing how teledentistry is different than a normal brick and mortar store, how we are accessible to people. Firstly, I guess the biggest understanding of this, how important teledentistry, telemedicine is, came into existence during COVID. Suddenly you cannot step out of your house and the pain is not going to wait because it's COVID outside. You have to do something about it, and especially patients or people who are staying at home, munching and all the not very nice habits that they are following. They're having dental issues. Now what to do? Your normal clinic is not ready right now to have that kind of virtual consultation set up. They are also in themselves figuring out how to get this done and all of those things. So and you can only have a certain number of patients in the clinic. You cannot go more than that. So that is where everybody got they were introduced to the idea of telemedicine and teledentistry. So that is what we are doing. We are very much prepared for any of the issues. Of course, we don't want any of it ever again, but definitely being prepared for these kind of crises, it's very important. Second is we are avoiding ER visits. We can avoid patients going to ER and waiting for a long time, or being an undue visit when that can be saved for some really serious issues. So that is something that we're doing, we're avoiding, so that the patient is at least on medication, can go back to a normal dentist and normal clinic and kind of get the treatment done. Then the other thing is with teledentistry, we are able to be available at all times. As I told you, dental pain can happen at any time. Especially it's a nocturnal pain where it happens when you lie down. So when do you lie down? These days, given the economy, you only lie down after, everything is shut outside. So then what to do at that point of time? So that is how we are readily available. Not just we are available for emergencies, we're also available for stuff like, your regular routine checkup, your simple consultation. If you want to ask about something, that is a lot of times people need to have that kind of conversation with a dentist. That is something that is possible with telemedicine, teledentistry. That is what we are doing. Your other question was about AI. AI has changed everything. Everything. So I'll tell you. Few months back, a year back, ChatGPT. What was ChatGPT like? Sounded interesting. We never thought it becoming such an integral part of our life. Right now, it's something that everybody is using in their day-to-day life. With us, how is AI helping? AI is helping us to kind of keep that kind of record. You have to understand where, if in a certain region the requirement of telemedicine, teledentistry is more, then you kind of improve the numbers over there. So then AI gives you an idea to filter based on region, location, problems, timings, everything. You can be better optimized for what is coming in.
Got it. So, like demand forecasting, and I hear this a lot across various industries. We are also helping a customer where they hire a lot of technicians to go work on HVAC. So they benefit a lot from us forecasting how many calls are they going to get. So similarly, if you knew that around this season, because we marry the data, their historic data with weather data as well. So they have a forecast that, okay, they're going to get approximately these many calls. So they keep their technicians ready. And it's similar for you to also have that many dentists, on availability for if you know what kind of a demand you could be getting and from what regions, what time zones. So that's super interesting. Okay. So demand forecasting, anything else that AI right now is helping with?
Okay, AI is also helping with understanding, the disease process in itself. So you can segregate high risk patients. You can know that okay, this has happened in, if you understand the nature of the disease happening, you can kind of foresee something happening. So you can focus
based on the symptoms.
Yes.
Use AI and predict what might be the challenge. Absolutely. Now
That is like, and that's like, if I'll tell you a very basic idea. I can, as a dentist, avoid a lot that is happening with respect to their teeth with my family, but I cannot be everywhere. That is where AI is there. Like, AI can help a lot of people in terms of understanding. They might not know, there is sensitivity. They might not know what they have to do. But we know that if there is sensitivity, if there is something like this, if the case is progressing, how do we need to address that? So anything in dentistry or in any of those core specialties as well, if you address a little early, you are one, saving a lot of money, and second, you are also saving the patient a lot of problems later in life.
got it.
So,
Got it. So look, these are great examples. Now, what about the scare that a lot of industries have about AI taking everyone's jobs away? I know that that may just be for the marketing folks or the content writers or the creators for now. But what about that impact in the healthcare industry or specifically in the dentistry?
Okay, so the moment you said scare, I was like, okay. Now the scare that we are talking about, AI is of course scary. The accuracy that it is coming from ChatGPT 3.5 to 4. I mean, you can create your GPTs, you can create a person to handle your marketing, you can create a person to handle your other aspects of it. So definitely the scare is there, but I'll tell you very honestly, I have done my MBA, and my core topic was AI in healthcare. So I can give you a little bit of idea of that. Should people from healthcare be scared that AI will take over their jobs? Definitely no. So they be scared that AI is going to be indirectly responsible for their job scarcity? Yes. How? Because they will be replaced by people who know AI. They'll not be replaced by AI itself. They will be replaced by people who know how to utilize AI to the max. Today, I can do something and somebody else can also do this. If I can do it in less time, I will replace that person. If that person is able to do that same task, because time is money in this time and day and age, if you are able to utilize AI to reduce human effort, AI is not just reducing the time taken, it is also eliminating the human error.
Yes,
So,
absolutely. So I guess then the advice for younger people or even, older people could be to always stay up to date and embrace the changes and the technology and be in the know and read about it, I guess. Is that a fair?
definitely read about it, reach out to people people like me, and there are a lot of people who are just crazy about AI, and we want to talk about AI. We want the world to actually know, because if we can only collectively develop. It is not a competition where know AI and that person doesn't know. It is, if we all know how much more we can do, because right now there is a very big population that is not being helped because the number of dentists or because the number of doctors over those people are less. Can we reduce the human effort? And as I'm talking about, I don't want to be confined to 20 people, but I want to be responsible for a bigger number of people's lives. So that is what, with AI you are able to do that. And we all have room. We all have, if we all today get into the AI, and we kind of are able to help more and more people, it's not going to be like the job is going to be done. You still need more and more people coming in.
Makes sense. Makes sense. Okay. Well, shifting gears now towards, some challenges that AI can present, or just generally in the healthcare industry. Like, what significant challenges have you faced in the healthcare industry?
Okay, so significant challenges in healthcare. Uh, since we're talking about AI and data, I'll tell you, previous to the AI revolution, previous to being able to have that access to that kind of resources, it was very difficult for someone to uh, see a patient without any data with respect to the patient's case, with respect to any new practicing dentist. I mean, everybody starts somewhere. You cannot, you can read everything about a certain disease, you can read everything about a certain problem, but you cannot really experience it. So the experience and the judgments that you kind of form, it takes some time, and you cannot be perfect right outside the college. So it the challenges that we faced was lack of experience, lack of access to the patient's entire record. Not a lot of people are able to carry the records with themselves. I am talking about a time, and I belongs from a place where, patients will bring in a very small paper with them that, this is what was done last time. I have no idea what was done before them. And they will expect that some doctor, I told that person that I had diabetes, now this person should remember, and they should kind of keep reminding everybody who is coming in their place. That is not how things work. Even if the patient has told me, I might forget. And if I don't have a written record, that is going to be very challenging. So being able to access that data was the biggest problem, that biggest challenge that I faced. But now we have EMRs, we have digital records. That is why digitalization is so important. We have those records. The records are not going to forget. Your computer is not going to forget. If you are putting it in the cloud, it's not forgetting. So that is
We're
best.
already there, and I see that it is. Of course, the digitization is everywhere. But what new advancements are you looking forward to? What is not there right now that you anticipate could be in 24, 25, or maybe even beyond? What's missing?
Okay, what's missing? Okay, imagine a scenario of you 20 years from now, you're sitting in a place, and you suddenly have a certain emergency, a health emergency, and AI is able to help you get to your hospital. AI is able to help you with your insurance claims. AI is able to help you kind of give you that kind of emergency medication while you're on the way. This is how we are right now. This is how you compare your your normal course that it is taking. But now imagine the course that we from healthcare background, we actually want the route to be, you should never be facing a healthcare emergency. So we are shifting from disease care to healthcare, but the shift has still not happened entirely. We're still very much disease focused. And that is where, I would say that this is the kind of change that we are really hoping for to happen. Because the way everything is going, it's just avoiding when the issue actually arises.
Well, great. Well, what role do you think startups and innovative companies play in shaping the future of healthcare technology or in dentistry? And are there any like notable success stories or examples of, that you would like to share here?
Okay. So startups, if you see, uh, right now, a lot of healthcare startups are focusing on their niche. They're focusing on one thing at a time. It's not like, you're trying to solve everything at all times. You're just figuring out a kind of audience that you would want to solve for, and you're being very hyper focused on that. And you're doing everything that is required for that audience. So how we are doing a teledentistry, we're not saying that we need patients who are going for root canal. We don't need patients who are going for implant. We right now need the patients, or we are trying to only help the kind of patients that are coming in with an emergency, that are coming with an emergency that they're not able to access. Very hyper focused that patients who need care but not able to get that care in time is what we are solving for. These startups are actually being very specific of what problem are they solving, because today bigger problems are solved. Right now, we are not uh, in that space where you have to solve for livelihood, for food and stuff. Of course, I mean, I'm not saying that that's not an issue, but as a country, that's not something you have to only fight about food. It's not 100 years in past. Right now, we have a lot of things scared. But these are the nuances and the new focuses that we need to take into consideration. That is what is happening.
How old is teledentistry.com? Is it also a startup?
It is a startup. So basically, we just started, with our functions just before COVID. I mean, COVID happened, and we were like, okay, what's happening? COVID was something that made us mature a lot earlier than we would have matured generally. Like, we would have taken one step at a time. It was like in a space where in 2018-19 you're just figuring out how things are going to turn out, and then suddenly you're like, okay, no patient can go in the clinic, every patient is going to come to you. And we were not of course we were ready, but we were not mentally ready that okay, this is going to be the change that we're going to see. But we're glad that we were there when it was most required.
Got it. No, the timing was perfect. I'm glad that the teledentistry founders started something beforehand. It's kind of like even Zoom, right? Zoom was very popular, but after the pandemic or during the pandemic, it was the backbone of all meetings, and they had to put together a lot of the infrastructure and a lot of different features to enable that large of a user base. So I think something similar happened. Then you just skyrocketed during that period. Very interesting. Well, finally, what exciting developments and trends in 2024 do you foresee in the future of healthcare technology, and how do you think that will shape the industry in the coming years?
Okay, so I can see a lot happening with healthcare. Of course, 2023 was a great year in tech, in healthcare, in everything for that matter. But I can see how 2024 is going to just back on that. I mean, when you talk about 2023, it was going from 0 to 1 with AI, with so much happening. Now is the time when it goes from 1 to 10. This is then the real, colors of everything. Because even when we're talking about ChatGPT and all of that, and we're saying it's a big part of us, our life, it is a big part of a very small population. It's not reaching to the people who it is actually going to help for to solve a lot of bigger problems. So that is where I can see now the seeds have been sown. Now you can see the benefits coming in. It will reach to bigger audience. It will reach to the audience that it actually should be catering to. So that is what I can see in 2024 happening. I can also see people finally understanding and making those sort of calculations, okay, what they want from healthcare, because right now, when I'm talking about teledentistry, uh, a patient would still, like, there are some patients that are like, okay, I still would want to go and see the physical, like, in-person appointment. But when it comes to them doing the math, and they're like, okay, maybe this is something that is run cheaper. This is something that is saving my time. This is something that is saving me that hassle. Why not? I do one consultation here. I have the solution in hand, and then I go when I'm actually required to see the doctor. So people really understanding that it is not we versus brick and mortar. It is we and brick and mortar together helping the patients. So that is where the understanding,
That mindset
the
change
shift.
to expect
Yes.
in 2024. Got it. Got it. Well, very, very interesting. Awesome. Thank you so much, Dr. Mamta Kodwani. I appreciate your time. We had a really wonderful conversation and it was a lot of learning. Thank you for sharing your thoughts with the community. And I'm looking forward to having many more conversations with you and staying in touch. And thank you for your time for this podcast.
Hi, thank you. It was lovely. I don't remember how the time went. Like we just started, I thought, and
Oh,
yeah, we are here. Okay, it was super fun. It was amazing. I am, of course, waiting to have these conversations more with you and figure out what we have in future for us.
awesome. Well, fantastic. Thank you so much for being a part of the
Thank
community
you.
and looking forward to discussing more soon. Have a good one. Bye bye.
Happy. Bye bye.